Hi everyone, this is Grace here and I hope you all are doing alright. In this video, we will be talking about how to apply Dr. Claire Week's approach on dealing with the symptom of palpitations. Now, Dr. Claire Weeks talks about the same approach for any physical symptom of anxiety, whether it's dizziness, whether it's headache, nausea, palpitations, tingling, tremors, all of it. The approach is the same. I'm just choosing to talk about it with respect to palpitations in this video, and her approach mainly has four steps to it. The four steps that she has outlined are facing, accepting, floating, and letting time pass. Now, when you say facing it, she talks about facing what it is and not running away from it. So, if it's palpitations, you accept it that yes, it is what it is. It is palpitations being caused by anxiety. Now, of course, I'm presuming that we've got ourselves checked not once, maybe twice, thrice, and we've been told that the heart is all healthy with respect to palpitations. And when it comes to acceptance, you accept that this is what is happening. Yes, indeed, it is because of anxiety that my symptoms are there. You float with the symptoms. Floating means that you do whatever it is you would have done had the symptoms not been there. And letting time pass is you don't fight or you don't do you do things to make the symptoms go away quickly. Rather, you let the symptoms run their course and go away by themselves. Now, in my experience, while these are four steps or four points which have been highlighted by Dr. Claire Weeks, when you're applying it in any symptom, when the physical symptom comes, it's not necessarily in this four-step process that you deal with it. It's not that first you will face it, then you will accept it, then you will float with it, then you will let time pass. Not necessarily. It's just an approach. You don't have to break it down into these four steps. So, when it comes to palpitations, what will this look like? What will these four steps or what will this Claire Weeks approach look like? It will, the first thing will be letting it be. So, when you experience that the palpitations are happening, you just let it be. You let it happen. You don't go and clip on an oximeter, or you don't check the pulse, or you don't measure the pulse and you see whether it's 100 or it's 120 or it's 140. How does it matter, guys? This has probably happened 100 times before with you. How does it matter? Just let it be. Don't check it. Again, I'm presuming we've got ourselves checked this and that, all the tests have been done. And it's just anxiety. You don't have to go and check your blood pressure at that time. Let it be. You may get the thought that what if this is the time where, I need to check, this time seems different. Let it be. Let it be. Don't go and check it. Just let the symptom be. You make yourself comfortable. You don't have to be in an uncomfortable position. So let's say, if you are, for example, okay, you're wearing something very tight, and you are, that's making you feel uncomfortable. Sure, you may want to make yourself comfortable. If you're in a place which is very hot, or you're feeling very hot right now, you may want to move to a cooler place. You don't have to struggle, but whatever you do, make sure that you're doing it from a space of ease, from a space of acceptance. You do not Google your symptoms. You do not Google your symptoms. You don't, every time the palpitations come, you don't have to go online or immediately log into the forums and check that, what is going on. Repeated palpitations, what does it mean? Palpitations in the morning, palpitations after meals, what does this mean? You let it be. You do whatever it is that you would have done had the palpitations not been there. You don't hyper focus that on the chest, that is there pain also, is there any dizziness also, am I feeling any tingling in my ears. It's just what it is. You, let's say you were doing something, whatever, you were talking to somebody, or you were working on your computer, or you were heading to the kitchen to do the dishes or to cook, whatever it is that you were in the midst of, you go ahead and do that. Let's say you were planning to step out for a run, maybe you've had a spell of great days, and now you're back to exercising and you were just going out for a run, and the palpitations come on. So then, reasonably speaking, maybe you don't feel ready to go out for the run, but you can still go out and do your brisk walking. You don't go inside and start checking your blood pressure and your pulse, and you don't decide to, go and lie down and rest. So this is what it would mean to use to apply this approach. While you are waiting for the symptoms to pass, you just carry on with your life and do whatever it is that you would have done. Now, along with these steps, that she talks about, the 4 steps which I explained, will look like, just and your approach to your symptoms. I think the most important thing that she talks about, which is really our key towards recovery, is to not add second fear. So, understanding the concept of second fear and to train ourselves to not add second fear. Now, how do you not add second fear? And this will require you to not just do things when the symptom is there, but also everything that you will do when the symptom is not there. Everything that you will do in terms of your mindset, in terms of physically how you take care of yourself, everything. So what will that look like? One, fully accepting that you have anxiety, fully accepting and understanding that yes, your nerves are sensitized, as Dr. Claire Weeks puts it in her book. This is what sensitized nerves do. They increase cortisol, they increase adrenaline, they randomly increase these stress hormones, and every hormone has an effect. And the effect of these hormones is one of the effect is to increase your heart rate. That's what's happening, plain and simple. That's what it is doing. It does not mean anything else. Now, also remind yourself that you've had palpitations in the past, they have come and gone, nothing has happened. There is the tiny voice in your head that tells you, this is going to probably weaken my heart, this is heart attack, my heart may randomly stop, but none of these things have happened in this 100 times that you've experienced palpitations. This moment, this episode is going to be no different. The other thing that you are going to do is exercise. Move your body in a way, because in a way that gives you more confidence. Don't get afraid that you're putting pressure on your heart. And while this is something that she does not talk about specifically in the book, in her book, or in her approach, but I think that every time you're dealing with certain symptom, what is going to be your mental talk, your approach to your symptom, is going to decide whether you add second fear or not. And how you don't add second fear, or how you stay calm towards a symptom, will have a different approach for every symptom. So, like in the case of palpitations, for example, if you have been exercising, if you have been increasing your heart rate during those exercises, if you've noticed that you're not getting breathless, you then have this memory to go back to when the palpitations come. Rather than thinking about, let's say you get the palpitations now, rather than thinking that, oh my God, this is not good for me, I need to sit down, I need to book an appointment, I need to go back to the cardiologist, or I need to go get an ECG again, you can go back to the memory of the run that you had last evening, or the exercise that you did this morning, and everything was fine. And if your heart survived that, it means that your heart is healthy. And that is an approach that you can use to not add second fear, because ultimately it's everything that you tell yourself. Physical, let's accept it, physical symptoms like these palpitations, they are pretty strong symptoms, they're pretty strong sensations, and you need to have a loud voice telling you that, hey, it's only anxiety, it's only the stress hormones which are causing this. And for developing that voice, you will have to do things at other times when the symptoms are not there. So, accepting wholeheartedly, understanding what anxiety is, what stress hormones do, training your body, like in the case of palpitations, exercising, increasing your heart rate, challenging yourself, and seeing that, yes, I do have good stamina, my heart is fine, I've never had chest pain when I'm exercising, I've never gone out of breath when I'm exercising, so it's just palpitations due to anxiety. All of that is going to prepare you to not add second fear for the time when the symptom actually comes. Remember, it's not just what you do when the symptom comes, it's everything that you will do when the symptoms are not there as well. It's change in your mindset, it's how you respond to situations, it's what you tell yourself, it's whether you are trying to hide your symptoms or not. You need to look at all of those things. So, this is the crux of what she talks about. And in terms of palpitations, I hope this has been helpful. And do let me know in the comments how it is for you when you have palpitations. What do you do? How you deal with it? And how do you apply Dr. Claire Week's method? I'll see you in the next video. Till then, take care.